Welcome to Schein Chats. If we could start off, just talk a little bit about, what you've seen in your professional career and what you see overall in the dental school and in your position at FDI about the challenges that exist because of the lack of standardization of uh, dental field and medical field record integration.
We're talking about the future as we're looking at where we need to be going. We really need to get everybody on the same, kind of on the same health record. I will take it. Let me take it one step further and kind of look into the future a little bit. You and I both do a lot of traveling around the world. Uh, my health record, my dental record, my medical record are in two different systems here in Greenville, North Carolina. If something happens to me overseas, or if something happens to me in some other part of North Carolina, we still have to locate records. I would hope in the future that we all have, at some point, we have an integrated electronic health record that kind of goes with me. So if I'm in another part of North Carolina, another part of the U.S., or someplace else in the world, and something happens to me and I'm unconscious, they're able to locate my record, know my health history, know my allergies, know my medications,
Well,
know what doctor visits I've had recently, and that sort of thing.
oral health professionals and medical professionals certainly have an opportunity to collaborate, uh, but the volume of information itself can become a barrier to collaboration. And so, why do you think it's important to define the specific fields that are shared between and amongst the healthcare professionals?
Uh, I think for exactly what you said, there's just so much information that we have, and there's parts of a medical record, the existing medical record, that we might want to have in our dental record, and vice versa. And I think that's the beauty of this consensus statement. It listed 8 or so oral health indicators that we would hope would be from the dental side into a medical record. So when we have an integrated health record, we'd have these indicators, and they go everywhere from everything from periodontal status, and as you know, the interconnection. That's probably the best link between oral health and general health is periodontal disease. But it has things like maybe a cancer history you might have, caries, pulpal health status. If you have implants, that would hopefully be in there as well. But more importantly, or equally importantly, is the prescription and medication records. It would be nice to have those certainly in both locations. Allergy, and I've already mentioned, medical history and that sort of thing. High blood pressure, whether you have bleeding disorders and all that, we would want in there as well. And then radiographic images. So if we have those 8 oral health indicators that we see in the consensus statement, that would be a huge first start.
Well, in that standardization of kind of the floor, the base level of information sharing between oral health professionals and medical professionals is quite a profound evolution in terms of developing consensus. Why, I guess I got to ask, why is the FDI World Dental Federation and its corollary on the medical side, why are these the right associations to be putting out this standardized process?
First of all, FDI represents about a million dentists worldwide in roughly 130 countries with 190 member associations. Through our member associations, we're able to advocate for different policies. Certainly, we work with partners. We work with WHO, with IEDR. IEDR and FDI are both in official relations with WHO. We also work with our corporate partners. And this consensus statement is a great example, of how we work with your company, David, Henry Schein, to develop this consensus statement. And I think that's the key piece is oral health is part of general health. It all needs to be in one integrated electronic health record.
Yeah, and creating that baseline foundation of information that should be looked at and collaborated on between the two professions is really the point of departure that we all need to go and evolve and transform. And so let me end with this, and this is a bit of the future casting. Uh, If this works out well and the adoption starts happening and oral health professionals and medical professionals really start collaborating using the 8 different indicators that were identified in the consensus statement, what does the future of the oral health care profession look like in the next 5 to 10 years? And why is this the right moment now for us to be trying to drive this adoption of a new way of working?
Well, I think in 5 to 10 years, hopefully, we're going to have an integrated electronic health record, certainly in the more developed countries. And I think as we work in those developed countries, the technology will get better and better. We'll begin to have better cybersecurity. We'll begin to advance the technology. It'll become more interoperable. Um, and I think it's just an evolution. But it's got to start somewhere, and I think it's already started. I'm excited about this possibility, and I go back to the consensus statement because I think this is a good document to begin to lay the groundwork for the future.
We thank you for the partnership on this and for FDI's leadership in going and putting out there a consensus statement that can become the foundational point upon which for healthcare professionals to be evolving the practice of care. Uh, Greg, thank you very much for your time. Thank you for sharing your insights into this important work. And thank you for joining us on Schein Chats.
Thank you. It's been a pleasure, and we appreciate the opportunity to be here. Thank you.